welcome to Hugo Social WGS Studio Talks. My name is Alexa Oliva, and today we have Serena Goldstein. Serena, introduce yourself and tell us what you do.
Yes, so I am a naturopathic doctor. So what that means is that I went through about 4 to 5 years of education. So the first 2 years is all conventional medicine. So think pathology, imaging, diagnostics, basic sciences. Then we have our first set of boards. The next 2 to 3 years are all the ologies, so like endocrinology, cardiology, gastroenterology, and then in addition to pharmacology, we learn botanical medicine, IV therapy, chiropractic, minor surgery, homeopathy, and hydrotherapy, and nutrition. So it's really more tools in our toolbox to not just treat the patient, but to get to the root cause of disease.
Oh my God. This is what you do. I didn't even know that was a thing, that a doctor could be so well versed in so many different things.
Yes, and that's exactly why I fell in love with this profession, because it offers so many modalities, plus a lot of the education and open mindset to be able to introduce even more. And then how do we truly individualize it for each patient?
What's the difference between you and, say, an internist?
So an internist tends to focus more on the GI, like the GI, maybe there's some heart, lung stuff. They are kind of that general, they'll do some of the different types of imaging, like the endoscopy, the colonoscopy. They'll really focus more on whatever's in the chest and the abdomen. For us, we're looking at, okay, if there's pain or let's say energy levels or hormone imbalances, when there's a number of different issues, we're trying to piece together, okay, what are the organ systems that everything is going through? And then at the same time, with our education in physical medicine, we could also take a look at the spine and how the person is sitting and what's their just overall affect. And where can we really start with therapies and treatment while going with the least invasive measure first?
I'm ready, Doc. I want to be your patient.
Awesome.
And so how do you offer these services to people that want to sign up with you like me?
Of course. So I always start with a 20-minute phone call because that always lets me know if I'm a good fit for you and vice versa, because so much of my belief system is over long-term care. So this is where you come to me with the different concerns. Okay, what have you done? What have you researched? I have patients who are very well researched, and we really come up with that long-term plan and the motivation to keep going. From there, that's when we look at what's going on in the conventional side and where can we go naturally. And then I always do telemedicine. I'm always offering that. I always say, too, I'm not tied to any supplement company. So that really lets me mix and match per patient. So I have some who love pills, some who love powders. We say, great, we could have it all. Most importantly is that you're also consistent with your plan. So again, everything, once we get through the initial 20-minute call, is very much tailored to you and your lifestyle.
Does insurance accept this?
Sometimes. So sometimes insurance can have the HSA or I believe FSA, some of those letters. And that's either where people can put money in an additional plan and then just draw it out, or the insurance company will actually have a pool of money set aside for more quote unquote alternative therapies. There are certain states where I would have been able to take insurance. However, personally, I did choose to become cash-based. Though that said, again, in certain states where we are fully licensed, which means we could be full primary care, insurance would provide for our services.
Oh, wow, that's awesome. There's hope for people.
Yes, yes. And licensure efforts would be a whole other conversation as well.
Well, that's awesome. Thank you, Dr. Goldstein. We appreciate you so much for taking your time and being here with us and giving us that information and giving us hope.
Of course. You're very welcome.
All right. Thank you for joining us for another episode of Hugo Social, Who to Know and Where to Go. My name is Alexa Oliva, and remember to live in love.